and welcome to E-News of IPR Department. I'm Manisha, presenting you all the news bulletin. Firstly, the headlines. Summary of COVID-19 Health Bulletin as on 6th October 2020. Sikkim prepares reopening for tourism. 72 BN SSB organized medical Civic action program for rural people. Now, in details. According to the health bulletin, it was informed that the state has recorded 3 more COVID-19 deaths yesterday. A 57-year-old female from DPH area passed away on 5th October at around 7:30 p.m. She was admitted to the STNM hospital on 20th September and had comorbid conditions. The second death was a 67-year-old female resident of Upper Arithang near Masjid. She had tested positive on rat at CRH. She was admitted to the STNM on 4th October and was also a diabetic patient. She passed away on 5th October. The third death was recorded from a 56-year-old senior MPHW from Rampur PHC and a resident of Jitlang, Rampur. He was a COVID warrior who was on screening duty at Rampur Screening Center since January 2020. 26 COVID-19 positive cases recorded yesterday, 5 on RT-PCR, 4 on TrueNat and 17 on rats. With this, the total active cases reaches 580, a death case reaches 49, cured and discharged till date reaches 2,506, cumulative total 3,135. In the earlier guidelines and SOPs issued by the Tourism Department, a tourist needs to have a COVID negative certificates issued 72 hours prior to arrival from a lab or hospital certified by Indian Council of Medical Research. As per the revised SOPs, a tourist must possess a valid COVID negative certificate issued within 72 hours prior to date of Sikkim arrival. The mandatory COVID negative certificate can be from any lab or hospital and not necessarily from those accredited with the ICMR. The first phase Sikkim Tourism reopening is only for domestic tourists and foreign nationals residing in India having a valid visa. As per the guidelines, the tourist must compulsorily register in the Sikkim Tourism web portal before travelling to Sikkim. On 6th October, 72 BN Sastra Seema Bal organized a day-long medical civic action program for the medical aid of local people at village Sopakha under 21 Manebung GPU West Sikkim yesterday. The medical camp was run by Dr. P.D. Upadhyaya, Deputy Commandant Medical and a paramedical team of the unit. Dr. Bhushan Sarma, MS Senior Ortho Surgeon, also participated in the camp and provided his service to the local people through his medical camp. Srimati Gaumaya Limbu, accredited social health activist, and Srimati Rita Limbu of the village also assisted the medical camp. Most of the patients were old age people. Total 45 patients were checked up and were provided free medicines. The medical camp was organized to help the people who were in need of various kinds of medical assistance and were unable to go to hospital due to outbreak of coronavirus. The camp was executed following all the necessary precautions, keeping in mind regarding the ongoing COVID-19. Now, some national updates. India recorded 72,049 new cases of coronavirus, almost 10,000 more than Monday's one-day cases, and 986 deaths in the last 24 hours, taking India's COVID-19 tally past the 67 lakh mark, shows the Health Ministry India released this morning. A total of 82,203 people also successfully fought off the viral disease in the last 24 hours, bringing down the overall active cases to around 13% of the total case load. According to the government figures, total COVID cases in India now stands at 67,57,131, including 9,07,883 active cases, 57,44,693 recoveries and 1,04,555 deaths. The Meghalaya government has also decided to withdraw free coronavirus testing facility in the state. From October 16th, people of Meghalaya will have to pay for coronavirus tests. Meghalaya Deputy Chief Minister Preston Tingsong said, from October 16, anyone who wants to go for COVID-19 tests will have to pay. It will be applicable for both permanent residents and the people who will come into the state for business purposes. This much for today. We'll be back with the more updates. Keep watching E-News of IPR departments. Thank you.